I fell into the epidemic as we all did in the very earliest days. I was almost kind of crazily well prepared for the early epidemic. I was trained as a retrovirologist. I'd been working in virology labs with the virus that obviously was related to what we saw with HIV. I was working in Jay Levy's lab, who was one of the co-discoverers of the HIV virus later. And I was trained as an oncologist, as a cancer specialist, so very comfortable working with patients with terminal illness. And in the early HIV epidemic, that's clearly what it was. The early epidemic was incredibly challenging. We had nothing to offer in terms of treatment. It took years for us to have that. And the numbers of patients exploded. We saw a doubling, as I call it, every 6 months or so in the early epidemic. We were one of the first centers to participate in the first clinical trial of AZT that was then accepted as evidence by the Food and Drug Administration for its approval. So I was part of that whole process and did a lot of clinical trials at the time myself with AZT, and realized that it did have activity. I mean, I had patients that had a very substantial recovery clinically with AZT. So it could work. On the other hand, there was a lot of controversy. We were using it in very toxic doses. The convenience factor was horrible. It was being taken every 4 hours, and it didn't do very much. It nevertheless was the first drug that had any activity for a disease that was otherwise a complete death sentence. So AZT was the first break in that, and a very important one. It stayed around as an important drug for, 15 or more years. And when we see the story of the baby that was cured recently in Mississippi, baby started on AZT as one of the drugs, so it stays an important drug. Well, in the very, very early days of the epidemic, there started to be meetings organized to compare our experiences, to compare the research findings. And the first large meeting was organized in Atlanta in '85, and then the next year in Paris, 1986. And in Paris, a small number of us, I remembered as maybe 10 or 12 people, got together really very kind of spontaneously almost to say, well, what could we do? How could we organize for the future of the international conferences? And so we decided to form an organization at that time that would do this. And then I think the organization officially was formed in 1988, but it really began in 1986. By 1987, the scale of the epidemic was still exploding, and it was seen as an important political issue because of that, and international too. So it was the first time that there was this community activism versus politician flavor to the conference. And outside the doors, of course, there were the Washington police in yellow gloves arresting protesters who were at that time more outside the conference than inside the conference. So it was really a transition point, and very quickly, of course, the activists were part of the conference, inherently part of the conference. So the San Francisco conference in 1990, first of all, I had just become president of IAS. That was my inauguration as the president. And during that year, the realization of the U.S. immigration policy became clear, and it allowed the government to prohibit HIV-infected people from entering the country for any reason, including pleasure or business travel. And the calls for boycotting the conference, the threats, the bomb threats of our organizing office became kind of a routine thing. And so we put together a meeting that was an amazing thing because of the threats that we faced. So there were many issues that made that without any question, the hardest year of my life. I'm just a doc. I was just taking care of patients and trying to do my best in responding to this, and then to find myself in the middle of this controversy was a real challenge. And then as the IAS president, being expected to respond with that responsibility was also a real challenge. So what I had to do was to moderate this discussion in the IAS about what was the organization going to do with the U.S. policy. And as an American, I saw the value in this meeting, and I knew that American science was leading the way in many respects. But after a lot of deliberation, we decided as an organization to ban the meeting from coming back to the U.S., which was a very tough decision. Well, during 1990 to 1992, the biggest issue was, of course, the immigration policy of the U.S. and what that meant for the organization and for this conference. But beyond that, I think I remember it as a time of real despair. I remember the Yokohama and the Berlin meetings as even more bleak than the San Francisco meeting. At San Francisco, we were seeing the first glimmers of hope from AZT, but that hope had been somewhat diminished within a few years. So that was a tough period. During that time, again, 1990 to 1992, there was really some optimism that vaccines would be possible. I remember conversations in the Florence meeting about that. There was, I think, probably a more sophisticated integration of the community and activist voice into the conference, and that was obviously a great thing in retrospect. And we were certainly learning a lot more about this virus during that time. It took a while to translate that into the Vancouver conference, but we were laying the groundwork for that with the science. I remember tears coming to my eyes in Vancouver because it became possible to imagine the end of the epidemic. It became possible to imagine curing this virus. Obviously, it took a lot longer for even that to begin to seem a real possibility, but the Vancouver conference was the high point of this in many ways. What's really striking to me about IAS is the incredibly global nature of the organization. Right from the very start, the structure of the organization has been very international. So I think the IAS is in many ways the voice of the global epidemic and the response to it. It's certainly where political leaders turn if the question is, what are we doing with this global epidemic? And that's not taken away from the World Health Organization, UNAIDS, and other large structures, but I think this is a unique role of IAS. The fact that it, as an organization, again, confronted the U.S. immigration discrimination successfully, if after 22 years, is an example of that. So I think it's played a very important leadership role. I wish I could be more quickly optimistic about a cure. We still we're about to hear the World Health Organization announce finally moving to basically treatment of all HIV-infected people, which I think a lot of us think is absolutely necessary for this infection. At a time when economic resources seem to be constrained and where we can't yet imagine even responding fully to the original treatment goal. So even if we just imagine what's required to use the current drugs for this epidemic globally, we have a long ways to go. So I'm totally with it, and I think the IAS has done an incredible job of putting the cure front and center as a goal. But I'm going to be in the background saying, but let's make sure it's cheap. let's make sure it's affordable to the people that really need it the most.